Today we are going to show you how to use TENS, or transcutaneous electrical nerve stimulation. It's a form of e-stim that uses the gate control theory to block pain signals to the brain. This is considered the gold standard for acute pain management. First, you should ensure your patient has no contraindications, such as malignancy, implanted devices like pacemakers and insulin pumps, or cardiac arrhythmias. It's also important that you don't perform this over the eyes, temporal lobes, or over the pelvic region of a pregnant female. Next, you should prep the working area and explain to the patient what is going to happen.
Okay, so I'm doing TENS on your lower back since it's been hurting you. So I'd have you lift up your shirt a little bit. First, I'm going to clean off the area with an alcohol pad where I'm going to put the electrode. And so what you're going to feel is a tingling sensation, or like a pins and needles, but it shouldn't hurt at any point during the treatment. And you shouldn't experience any muscle twitching because we just want the sensory level.
Okay.
So let me know if it gets painful or anything.
Okay.
Hook it up and turn it on.
The unit settings for a sensory level stimulation, which is used in acute pain, should be at a frequency of 50 to 110 pulses per second and a pulse duration of 50 to 125 microseconds. This should be a simple modulated pulse to avoid acclimation, and treatment time should be 20 to 30 minutes.
Okay, can you feel it?
No.
Okay, is it painful at all?
No.
Or is it, okay, it's tolerable? And there's no twitching on the muscle. And so, one thing you want to make sure is that since this is a pain modulation technique, modality kind of thing, you want to explain to your patient that it's very temporary and it's not going to relieve their pain for very long, but it will help. And you want to, yeah. So I'm going to take, now I'm going to take the electrodes off and examine the area and make sure there's no redness or skin irritation where I put the electrodes. And next I would ask her about how she liked the treatment and if she, like, how her pain is before and after. So,
okay. Also,
feels better. Okay.
So it's also important to note that this modality is not just used on its own, that it should be adjunct with other interventions. We have showed you the sensory level, level 2 pain inhibition. Level 1 is subsensory and used for bone healing. Level 3 is hormonal, 4 is noxious, and 5 placebo. The frequency and pulse duration will change depending on if you want a different effect from TENS treatment. Thanks for watching.
Thanks.